Hi, everybody. I'm Evan Smith, the CEO and co-founder of the Texas Tribune. I'm pleased to welcome you to a discussion about the ways in which pandemics highlight and heighten health disparities across vulnerable communities, what we've learned during this extraordinary last year, and how it informs our efforts to prepare for future public health emergencies. I'm so pleased to be joined by four great, smart guests. Their selfless work and that of their organizations has made a huge difference during this extraordinary period in this country and in our world. Paurvi Bhatt is president of Medtronic Foundation, a philanthropy expanding access to healthcare in underserved communities around the world. Ellie Hollander, president and CEO of Meals on Wheels America, a leadership organization supporting the more than 5,000 community-based programs across the country dedicated to addressing senior isolation and hunger. Dennis Walto, CEO of Children's Health Fund, committed to making high-quality, comprehensive healthcare available to children and families in underserved communities across America. And finally, Yasmina Zaidman, Chief Partnerships Officer at Acumen, a venture capital fund for the poor supported by a global community of philanthropists and businesses focused on ending poverty. Welcome to you all. I want to begin by asking each of you to reflect on the magnitude of the last 13 months. We all get to a point in our careers where we think we've seen it all, but none of us, Ellie, had ever seen anything like this, right?
No question about it, Evan. Practically overnight, we had to suspend service at hundreds of senior centers across the country, create grab and go drive-through sites so that seniors who were more mobile and not yet sheltering at home could go someplace to get a meal safely. And at the same time, we had to serve millions more seniors who, not only the ones that we were serving before in their own home, but those that were then rendered homebound because of the pandemic. And we're still serving in a tremendous volume of seniors today that have not yet been able to go back to their routines.
So need goes up. Capacity doesn't necessarily go up automatically, but you have to ramp up capacity to meet greater need, right?
Absolutely. At a time when, as you know, you're having to secure source PPE equipment, right, cleaning supplies, food, transportation, everything along the supply chain that's challenging and more expensive. And you don't want to miss a beat because we are a lifeline for millions of seniors who are depending on not only that nutritious meal, but counting on seeing somebody in a given day.
Dennis, Ellie's organization operates on one end of the age continuum. Yours is focused on the other end of the age continuum. Same question to you. Reflect on the magnitude of what you've seen over the last 13 months, both the growing need and the need for growing capacity.
Thanks, Evan. Great to be here with everybody, and thank you. In preparation for this panel, I really looked at the panel topic. And I thought about the pandemics and health disparities. And I unpacked that word disparity because disparity means not equal, right? And we knew a lot of these inequities going into the pandemic. We knew, for example, that unequal access to health services would result in unequal health outcomes. We saw that play out, much to our fear. We saw a disproportionate level of morbidity and mortality in communities of color, in under-resourced communities where we work. We had to respond and respond quickly. We had to think globally, but act locally because those issues, those challenges are best addressed by the local and proximate leadership that is already there. The first responders in those communities were already there. It was really up to us to make sure that we were able to provide resources and tools to them, that they could work on an appropriate localized response, which changed over the course of the year, right? We go back 13 months, screening and testing. Then there was the whole economic fallout and people needing access to food. Well, we're not a food organization, but we had to make sure that the clinics we support had food access and partnerships in place. Rounding out now, we're looking at vaccine confidence, right, and vaccine hesitancy, and trying to make sure that the same heightened morbidities and mortalities and lessons that we learned over the past 13 months can be used as an asset, right? in this next round and make sure everybody's immunized.
Well, I want to come to the vaccine question because I think, again, you're quite correct. The framing of this is, interestingly enough, on the front end, when the coronavirus pandemic hits, we have health challenges. On the back end, we have vaccine challenges. The disparities in each case are actually quite similar. Paurvi, to the point that Dennis just made, we have seen once in a lifetime crises over the last 13 months stack up like the planes at LaGuardia Airport. We had a pandemic, and then we had an economic downturn. Then we had a reckoning on race. We had an insurrection at our U.S. Capitol. I mean, we've just seen over the course of the last year, the fire hose of news and catastrophe turned up to the highest setting at all time. How, Paurvi, is any organization, yours or any other one, prepared for something like this?
Yeah, it's just that is the question, right? I think all of us have been going through that.
Right.
I can just reflect and say for us, it's very personal. I think that's how, is when you start to look at it from the very personal lens. For folks who don't know Medtronic, we are based in the Twin Cities. And so the waves of things that you just described, Evan, have been incredibly present for us all the way through to this month. And I'll have to say for myself, I'm an Indian American. So what's been happening over the last several months, but absolutely the last 10 days, makes it very personal as well. That this isn't something that is moving through phases in the way that we might think. What we faced a year ago, other countries are facing now. And we're all part of it in the same way. So one of the things that we do is we recognize, and we are starting to recognize, the old frameworks of disaster relief, while very useful, may need to be rethought because, to your point, things are happening at such a rate that this isn't just hurricane season. This isn't just wildfire season. Those things are happening too. But this is really now recognizing that the strain of what's going on due to inequity, which is more than inequality, is really forcing communities into stages of crisis. And so when we think about that, then how do we approach it from a very creative and personal lens? So for us, we're doing it again now as a company. We have to look at our families and our employees first, then go through our value chain and make sure we're a healthcare company. So making sure that the health systems that we support, the doctors and the patients that are directly impacted, whether it's economically or with their healthcare, have the support they need, and then the community around it, and to keep activating that. Virtual ways of working, which we all have talked about as if we've been doing it for decades. Boy, we learned fast that we had to figure that out. We had to do it with volunteerism as well. And I'm seeing it even today, right now, as we've got Indian employees that are sitting all over the world, just trying to figure out how to help. That helplessness we all felt.
Yeah.
Still feel at times.
I
we
think
were reaching out to heal each other through that avenue of virtual volunteers.
the personal aspect of this, I just want to say, I think you've really highlighted something important. We in the journalism business often talk about the unusual situation we find ourselves in, living the story that we're covering. And I think over the last year, that was absolutely the case. In the realm of philanthropy, doing good works, often you're doing good works in communities that you're a part of, right? So you find yourself having to summon up the strength and the capacity to approach something that is really very personal to you. There is no distance.
There isn't, but
right.
What I will say is that in this one, we all felt disparity. I take care of a mom. I'm a person of privilege in this country too. Right. I take care of a mom at home, but it was hard to get her vaccinated.
Yeah.
I think when we take that personal lens on it, we all kind of felt that moment of frustration of not being able to get what you wanted. And I think that is what has helped us with our empathy. And to put more evidence to what you're saying, Evan, that's actually what's helping us be more a part of community, is really recognizing those moments when we felt very similarly to what we know folks that are out of reach are feeling every day.
Yasmina, I want you to get in on this as well. Talk about the magnitude of the year. And I want to add a twist to it for you. And that is, how do you build a strategy for making a difference on the fly? Just as none of us had ever seen anything like this, none of us had ever prepared for anything like this. There was no playbook, right, heading into this.
Yeah, no, absolutely. And I think in some ways for all of us who have been working on issues of poverty and inequity, what we do see every day is the crisis that a person lives when they have that kind of vulnerability. So the concept of crisis at the individual level is not new, and we're trying to figure out what are the solutions and the systems that help individuals stay out of crisis. But the reality is that we saw systems in crisis, not just
Right.
communities or people.
Right.
And so what we've been doing for 20 years is betting on entrepreneurs who are actually committed to solving problems of poverty. It's obviously a unique breed of entrepreneur that wants to use the power of markets, innovation, reaching underserved people, but through a business model. And what we saw was obviously the vulnerability for the whole business community was huge. And we feared that this ecosystem of entrepreneurs around the world that are tackling poverty would essentially disappear. These are not companies that have huge cash runways and investors sort of at the ready. And as we saw in the US, it was very hard for small businesses to tap into even the relief that was designed for them. But we stood with these entrepreneurs, and we're part of an alliance of organizations that stood with social entrepreneurs specifically, because what was happening was that this was actually playing to their strengths, right? Their ability to connect deeply with underserved customers, to pivot, to innovate. And we saw that in spades. So I feel like in some ways, when we think about the vulnerability of systems, this has deepened our conviction that we need to start looking beyond the status quo, both in terms of sort of government and public institutions, but also private institutions, that they're not always equipped to pivot quickly and to serve the most vulnerable. A lot of investors have pulled back. A lot of funders stopped funding because they were uncertain of what they could do and how to do it. Whereas these entrepreneurs just leaned in and they showed up and they used the resources they had. Most of them emptied out their bank accounts so they could keep paying the vulnerable employees that they hired, because that was the premise of their business model. So we did a sort of emergency relief to support those entrepreneurs, both because they were on the front lines. So, if you're in lockdown in India, you can't leave your home, your income has dried up. So people were actually providing salaries and food in some cases so that these families were not going to sink into starvation poverty.
What I'm hearing, Yasmina, though, I'm hearing that that's a value, right? Those are values on display.
Yeah.
But really, no one could have imagined what would be necessary during this period. Again, there was no way to go back and say, had we really thought about what would happen if this happened, because this was an unthinkable thing. So if your values are right and you're nimble enough, you can actually respond in the moment.
Right. And I think what that means is that we need to be building on the premise of, I think, nimbleness and values. So essentially recognizing how much character matters and how much innovation matters. And also what I think all of our organizations do is investing in community level organizations, whether they're nonprofit or for-profit, recognizing that the strong infrastructure we need sort of has to be bottom up. Because in a moment of crisis, those are the folks who have the trust and the presence to respond quickly. And those are principles that can be built in to a more resilient system moving forward.
And as well, knowledge and relationships on the ground, right? People, the old Jeffersonian idea that government is best closest to those being governed also applies in this case, right? Help is best when it's offered in the form of sort of local knowledge, local relationships on the ground. Dennis, let me ask you to pick up the point that Yasmina made, a very smart point about systems being broken and this idea of, speaking of Jefferson, government. I'm old enough to remember when government used to solve problems. That's much less the case, or more precisely, it's harder today for government to solve problems alone, without the likes of many of you, on this call, without nonprofits, without for-purpose funds and organizations stepping up and stepping in. Without you, the money is not necessarily there. And to Yasmina's point, the nimbleness is not necessarily there. Would you talk about, Dennis, your view of the evolving role and responsibility in moments like this of people in your space?
Well, I think that the adaptability is critical and key. And part of that adaptability really, step one, right, is baselining. It is having a clear understanding of what exists and what does not exist in this health disparity, in these systems that are currently unequal. Right, we knew that in 2019, for example, that 40% of Americans could not afford a $400 health shock to their budget.
That was pre-pandemic. Pre-pandemic,
right? Probably, I don't know what the number is now. I haven't seen the new numbers. And we knew that more than 25% of Americans, 80 million Americans, live in a health professional shortage area. So even if they have coverage, they weren't able to access a provider. That's crazy. That number now, in looking at like mental health, right now there are 125 million Americans who are living in a mental health provider shortage area. And when we look at the longer term needs of communities coming out of this pandemic, we know that mental health needs are skyrocketing. We know that we're starting with a deficit. There needs to be a joint effort where we come together with the private sector to say, here's an immediate gap, here's our plan, here's how we reach a goal in a set period. I think that the innovation is critical because there's no way that government can do it alone. Government may be able to help sustain these programs. And I think this administration is taking big steps in that direction. However, the impetus, the spark, the innovation is going to come from the collective efforts of the public and private sector.
Well, in fact, you bring up a good point. The partnership is not just nonprofits and government, but it's actually a three-legged partnership. It's nonprofits, it's government, and it's the private sector, right? That's got to happen. Paurvi, I like what Dennis just said about the sort of pre-pandemic acknowledging that pre-pandemic things were not perfect, right? This didn't all go off the rails just during the last year. I'm in Austin, Texas. I live in a state that has had the highest number of people, both percentage of our population and raw number of our citizens, without health insurance for decades now, for several decades now. And we know that another 659,000 people at a minimum lost their access to health insurance during the pandemic because of the economic downturn. We still live in a country in which people's access to insurance is often tied to employment. You lose your job, you lose your coverage. The system is broken in some respects, right? The world that you live in, the world that you care about, we know that it cannot solve this problem alone, the system.
Yes. So I think the thing that we've got to recognize is that it's also the community member themselves that are a part of this. So it's four parts of the stool, not just three. And that's what we saw this year, right? We saw an uprising of the citizen, right? To say, this is what we need. And that's what's helping us reshape what we can think about and consider. What we saw pre-pandemic, or what the pandemic showed us, was the system that was always broken. And it only put more weight on a broken system. And your point about employment, right? Some economic viability and the engine that fuels is crucial. And I'll just say, from where I sit, we also appreciated that the final mile of healthcare was what we all needed and was broken as well. We couldn't get contact tracing to happen. We couldn't get vaccination home inside the household. We were only just getting it lifted so that you can bring health closer to people. There's only so much that can happen through telehealth, right? We saw that too. There is a moment that you've got to close it off. And all of that is a segment of healthcare that is either provided by the informal system, which is the community organizations that we all speak of, who tend to be the last in the chain. When we think about fueling and financing, they tend to be the last in the chain when we think about designing and figuring out what is needed. They certainly are rarely at the decision and strategy making table. But yet we need that group at the very end of this chain. And it's the first mile and the last mile is that segment of the informal sector. And I'll close here in saying they also are not paid. So when you think about community health workers, those contact tracers, those folks that we're really relying upon, this is the first time we all know who these folks are, and they are often not paid. And so when we come into realizing how dependent we are, what can we do to restructure that informal sector, make sure we're fueling not only the organizations, but the people that they can employ and should, and even consider vocational opportunities in a very different way to help fuel employment in the health sector in a different way as well. So those are things that I hope we're learning as we come through this. Other countries are starting to, and even reimbursability is beginning for that segment. But we can make it easier and faster, I think, as we come out of this pandemic.
Evan, can I tag on to that for a second?
Sure,
And then I'll tag on right after.
Then I want to go to Ellie right after that. So Dennis,
Corey, so important. I think there's an acknowledgement that we all need to make if we really want to look at a bottom-up system. And that is that the first responders are already there. They are in the household. They are in the community. You don't dial 911. Your first response is in the household. Building that capacity, the resources and tools to make your own decisions, to make them informed decisions, is where we want to be going if we're going to build back better.
Ellie, jump in on Paurvi's point, and then I want to ask you about the systems that you deal with specifically as you go do your work on behalf of seniors.
Sure. So let me build off of Paurvi and a little bit of what Dennis said is, a lot of of healthcare happens outside of a clinical setting. I mean, this is something that I think healthcare, and we all have been talking about for a long time. It's called social determinants of health. Yeah. And the trust that Yasmina brought up earlier, the ability to develop that trust in the home, crossing the threshold with the people that are underserved and not being reached, and talk about pre-pandemic, what the pandemic laid bare were existing epidemics around senior hunger, for example, just because I'm focused on the senior population, but also social isolation, something that all of us have now had the opportunity to experience, and it stinks. So this has really shined a light on these two issues. And we talk about vaccinations, and we talk about healthcare, we talk about trust and reaching people that are hard to reach, that are underserved. You have this infrastructure that is existing in communities, in every community across America, rural, urban, and suburban, Meals on Wheels, dedicated staff who are the frontline heroes too in their own way, not to take away from healthcare, critically important. But even healthcare will tell you 85% of someone's health is happening outside a medical setting. So, we really need to look at, where are these social investors, Yasmina? Where are these entrepreneurs? Where art thou? Because we need to make investments in these community-based solutions that are right before us, that have the interventions in place and just need boost in capacity so that we can reach more seniors in need, keep them home, keep them out of EDs and hospitals and nursing homes prematurely, and everybody wins, because all of us want the choice to be able to live out our lives as long as possible at home. And taxpayers would love to see reduced taxes, because Medicare and Medicaid costs have gone down, and healthcare will improve outcomes and reduce healthcare costs. So it's just a win-win-win, but we absolutely need to be looking at, how do we boost an existing infrastructure and really leverage the public-private partnership that Meals on Wheels has been based on since it was started, decades ago.
Ellie, I'll make the point also on this question of broken systems, that the systems supporting communities of seniors around the country showed themselves to be lacking in key ways at the beginning of the pandemic. The senior centers and nursing homes and other venues, they kind of made up for lost time in the last half of this last year. And fortunately, so many of the seniors around the country, many people who we know, family members, friends, are vaccinated, and their care is on a good foot. But the first 6 months, it looked like it was going to be the community of elderly people, seniors in this country, who were going to be most at risk, most vulnerable during this. That tells me that maybe that we thought we had good systems in place before the pandemic, and maybe we saw, as you said, laid bare the challenges that we had, right, in a moment like this.
Yes, I mean, I'm like Paurvi. Yes, yeah. but I really do want to also talk about the silver lining, because at least for seniors, when you look at all of philanthropy in the United States, I'm not talking about globally right now, and you aggregate corporate, foundation, individual philanthropy, less than 2% has gone to seniors and aging issues. Yet that is the fastest growing population. And as you said, Evan, the population that was disproportionately and impacted by the pandemic.
At least in the first 6 months of the pandemic, there was no population probably more impacted demographically than
right. Seniors. Right. But my broader point here is that we had people step up. We had individuals, we had foundations, Medtronic Foundation. We had corporations that we had never heard from or had the opportunity to partner with, who stepped up to the plate for Meals on Wheels in a way that did not happen previously, that enabled us literally in April. So March was when the pandemic hit. In April, we set up a COVID-19 response fund, and we were able to send, which is a big deal for us, $31 million in philanthropic support directly to local programs to help them serve more meals, serve more seniors. I think I mentioned earlier, 47% more seniors, 77% more meals at our peak. And that enabled us to really help. And then, of course, getting back to, I think what Dennis was mentioning earlier, the question of Dennis was the administration and Congress, members of Congress passed some critically important relief bills that enabled us to also augment that emergency funding with much needed funding for programs.
Yasmina, since you're focused on poverty, let me acknowledge that without regard to race or where you live in this country, whether you're old or young, if you were poor in this country, you were disproportionately impacted by the cascading events of the last year. How do you feel like the social safety net held up in the midst of all this? I mean, obviously we had an economic downturn that affected everybody in every place, in every way. It wasn't just employment, although employment was the door through which we had this conversation first, probably. How did that system hold up over the last 13 months?
I mean, I think we take a kind of a US and a global lens. I think one of the things that was most profoundly exposed in the US was the racial dimension of this inequity and how disproportionately this impacted people of color, with, Black and Latinx Americans 4 times more likely to get COVID, and then how many more were lacking in insurance. We talked about that earlier, but, Black and Latin Americans have 2 to 3 times greater likelihood of being uninsured. Right. So we have a safety net in this country, and I think globally as well, that assumes that the economy is sort of going to be the last resort, people's ability to earn income. And as you said, in this country, insurance is linked to jobs. In the developing world, most low-income people are in the informal workforce. Benefits isn't even a conversation. So you can be employed and uninsured. So to me, so much of the stuff we're talking about is interconnected with income inequality. And the fact that, even these health issues, we've talked about how, people deal with health outside of a clinic, but often people deal with health because of poverty. We see issues around access to clean energy where, people's health problems have to do with their source of energy or their lack of access to clean drinking.
Something as simple as clean water, right? Something that we all take for granted.
Exactly. And we're seeing, particularly related to the pandemic, a massive hunger crisis that is going to be happening all over the globe and is going to create massive health problems and stunting that has long-term implications for people's ability to thrive and, frankly, to be able to function as part of an economy. So I think what we've been interested in thinking about is sort of looking beyond the silos of, a health problem, health distribution, and thinking about how are we building systems that are more inclusive, that allow people to thrive, where I think, as we said, all of us, it's going to take everyone, but recognizing that for most people, the first step is having some level of economic security, some opportunity to be a productive part of the economy. Because from there, A, you avoid some of those social determinants of health issues, and B, you're able to actually participate in your own healthcare. Because the reality is that these safety nets are either missing for most poor people or aren't even being contemplated. And so it's, I think for us, we go back to the question of poverty and what are the systems that we're building across sectors that help people move out of poverty so that these issues don't affect them quite as harshly as we're seeing now.
Paurvi, I'm glad Yasmina brought up Black and Latinx Americans and the degree to which those communities of color have been disproportionately impacted over the course of the last year. Again, where you are in Minneapolis, you see race as a through line over the last, since May 25th of last year, and especially in the last couple of weeks in a way that most of us on the outside can only understand at a distance. You see it very much up close. Mm-hmm. Specifically on the question of health access and health outcomes, again, this is not a new problem. In my home state of Texas, we know that Hispanic Texans are twice as likely to be uninsured as Texans, 4 times as likely to be uninsured as Americans, right? So we know this is an old problem, but again, specifically the racial disparities during the pandemic, we see much more clearly than ever before.
Right, but this is one of those things where we realize knowing and doing are 2 very different things.
Right.
So we've come to a point now where we can't ignore it, even if we try. It's everywhere. I have to say, and I think each of us in our respective communities have probably faced that moment when CNN breaking news was in your backyard. But when it became our backyard to this extent, it allowed everybody to realize we have to do something. These racial divides have been going on in all of our communities for a very long time. We're all saying it, whether it's systemic, whatever words we put on it. Again, when you bring it personally, we know it. But the motivation to do something is a very different thing. And I think at this point in time, there's so much activism, so much nimbleness and need to solve for a problem that is, I think, helping us realize that you can't say it's insurmountable anymore. You have to start. And that, I will say, is motivating most of us in the way that we get involved. It is a journey of self-reflection. There is no way out of that. I think each of us as leaders in our own domains have certainly had to reckon with this for ourselves. And with that has come an evolution of how can we respond. We as a foundation are taking a hard look at our value chain. Is every dollar, even if our table is set with a diverse set of thinkers and racial diversity, even if we're influencing our decision, does every person who touches that decision after it leaves our hands have the same intention?
I'm glad you brought that up.
And I will say in philanthropy, we've had a problem with that. And so this is an important reckoning for us.
Does that cause, Paurvi, a change in strategy? So
Yes.
the events of the last year causes you as a philanthropy to pivot in the direction of the need, right? And in the direction of that narrative through line of race.
Right.
So much
Right.
of it.
Yeah, it does. And it's a change in strategy, not only because of the end community. It's a change in strategy that is about everyone on the pathway to that.
Right.
If we took a hard look at the base of who we support, is it really reflective of the community truly? Not just the intermediary to get to the end, right? But truly. And I think those are really hard questions. They're ones that we all have to ask of ourselves and then say, all right, we can't change it tomorrow.
Right.
But we've got to start. And as a company, so we have to recognize that, I'm representing a very specific segment of philanthropy, which is the corporate foundation world, which includes, of course, our employees and what they're able to do, but also the pace and the cycle and the brand reputation of what a company brings. And so these explorations of a value chain are not only what happens with us as a foundation, but across what we do as a company. And then oftentimes we even think, well, there's something to be said for what is happening with supplier diversity, which every company does take a look at. And maybe there's something about that analog that we can use and start to think differently, right? But if we're coming forward as many leaders, and I'm privileged to have a company that's really strong in this area and leadership that is very strident, but beyond saying what we need to do, it's time to really do what we need to do. And that is in this
show us
self-reflection first.
Right. Show us the receipts on that. I agree. Dennis, picking up on this, again, thinking principally about children as your constituency and families. Yes. The intersection of young people and race produces particular challenges when it comes to health access, right? I mean, again, I'm thinking about my own state of Texas, where I know 12.7% of children in Texas lack health insurance, which is more than double the national average. And Latino children are about 18% uninsured in the state of Texas. So, more than 3 times the national average. You understand this issue, absolutely, don't you?
Absolutely. And two quick facts and then maybe a comment. Race is not a social determinant of health. Racism is a social determinant of health. The fact that your zip code is more determinant of your life expectancy than your genetic code is something we can address. And it's something that we have to start with children and with access to care. And when I talk about access to healthcare, we're not just looking at, most people think about the payment mechanism. Well, you really need 3 pillars to really focus on access. The first pillar is the payment mechanism. Is it Medicaid? Is it insurance? There's more than 4 million kids in the US right now who are uninsured. You've got to have a payment mechanism. The second P is a provider. I mentioned earlier, the health professional shortage areas.
Yeah, we have to have access to care, not just access to coverage, right?
Exactly right. And the third one is the platform. How do those 2 meet? Is it a mobile clinic? Is it telehealth? How do we make sure we're bringing services where they're needed? If you build it, they will come. May have worked for a ball field in Iowa. It's not how you deliver healthcare in the 21st century.
Yeah. Yasmina, so now we've heard telehealth mentioned a couple different times. It's a little bit like a lamp you rub. Everyone thinks that all the magic of telehealth is going to solve our problems. But, you can't have telehealth without tele. And the fact is the digital divide in this country is, again, something else that was laid significantly bare over the course of the last 13 months. Here in Texas, which I know the best, 31% of rural households lack access to high-speed broadband. We know that if you're poor, regardless of race, regardless of geography, you're much less likely to have access to broadband. Yasmina, what does that do to this conversation, where you have lack of access to something that is so fundamental to all of our lives?
Yeah, no, absolutely. And we saw this because we had the privilege of sort of having a front row seat to these organizations and entrepreneurs that we've been supporting, who we supported through the pandemic, and how they were overcoming this. In the US, I think we recognize that they're organizations that have found ways to leverage technology, but they're so often finding ways to connect directly with the end users they want to work with, whether they're, Boulder is a social enterprise in the US that's providing access to addiction treatment. And they saw huge upticks in people's relapses in terms of addiction. So they had to be really creative about how they were going to reach people, not relying too much on just the digital technology, but the trust that they had built. And we saw the same thing in the developing world, where folks who were trying to provide whether healthcare, but also education. As we know, schools shut down all over the place. And our belief is education is one of the things that sort of puts people on a path towards a healthy, prosperous life. So when we saw a lot of these organizations saying, okay, we can't just tell the kids to turn on their computers, they were literally figuring out how to print and distribute material so that kids could continue to participate in education. And again, I think it's not to say that any one of these is a Band-Aid to solve this problem for everyone, but where we got most excited is when one of these innovative entrepreneurial organizations developed a solution that worked and then partnered with the local or national government to scale it and said, we figured out a way to handle this. Now let's take it to a bigger level. And we saw a lot of those partnerships emerging quite quickly. This is again moving beyond the question, but there's a company we work with in LA called Every Table that brings healthy food to basically food-starved communities in LA, and also creates jobs and entrepreneurial opportunities. But no one was going to any of these restaurants, and all their franchisees were basically going to go out of business. And they said, keep making food, we'll buy what you make, and we're going to distribute it. And they reached out to their entire network, everyone they knew, and said, if you want to get meals for people in need, we'll bring them. But at some point, it was actually the government that said, we need those meals, and we need them in, transitional homes for kids in foster care. We need them for the elderly. And they relied on a business that had built an infrastructure for healthy food production that was a for-profit that they converted for the purposes of relief.
And they probably saved that business in the process, or saved many businesses, right?
They saved the business and all of their franchisees. They're producing 3 times as much food during the pandemic as they were producing as businesses beforehand. So it's kind of like the innovation and that local infrastructure, which we think works a little bit differently with markets because they have relationships with customers and entrepreneurs who are actually selling things, but then linking it to the public sector to say, this is a time where we really have to take hands and do what's right for the broader community. And that, that's a dream that a lot of these entrepreneurs had that they've now been able to realize, because I think in some places governments looked to entrepreneurs and said, you can be a part of the solution. And that to us is a critical change, that they can't sort of stick with what they know. They have to open up their minds and say, who can be a part of the solution, and start to look at these entrepreneurial models.
Hey, Ellie, I want to ask you about a great answer, Yasmina. Ellie, I want to ask you about disparities along geographic lines, specifically as it relates to healthcare and the provision of basic services like providing meals to people. We've had a rural healthcare crisis in this country for many years. This is not new. It's been exacerbated during this pandemic. Would you talk a bit about that, please, and about the degree to which, again, zip code is determinant of a lot of things, but if you live in a rural community in this country, you've probably had a harder time, relatively speaking, over the last year, accessing basic needs, healthcare, access to food, vaccines more recently, kind of the whole 9 yards, right?
Absolutely. Yeah. Well, no doubt, a lot of our programs that do serve rural areas, many of their volunteers that they had relied on needed to shelter at home, because our volunteer network, 3/4 of whom are 55 and older, obviously many of whom needed to take care of themselves to protect their own safety. So a lot of our rural programs had to look to hire more people, because you could be driving 35 miles just to deliver 5 meals to 5 different people. And the resources aren't there. These are food deserts in many cases. So I mentioned earlier about this COVID-19 relief fund, which was a public-private partnership. People stepped up. We were able to help some of these programs get new vehicles. They were driving miles more, Evan, just to get to a few people. But interestingly, it's a little bit of a myth too, because a lot of us think, well, it's always worse in rural. But I will tell you that the issues of hunger and social isolation are also terribly bad prior to the pandemic and during the pandemic, even in urban and suburban areas.
Well, I'm thinking about all the we see these helicopter shots or drone shots of cars lined up at big urban areas at food banks, right? Where you have kind of miles and miles of cars, people waiting to get a box of food put in their trunk. That's
Correct.
not a rural issue. That's an urban issue, right?
That's exactly right. And that's what I mean. I mean, it's sort of a myth. The struggles that rural areas have are definitely great. In some cases, different. Broadband, big issue. Telehealth is great. I think what you're hearing is there's not a one size fits all intervention, is that you have to have a person and a community centered series of interventions that you try out, because you just can't just assume that if it works here, it's going to work there. That's why, these relationships with restaurants to keep them in business, because many of our programs had their own commercial kitchens. But if they were having trouble sourcing certain products, because seniors have certain special dietary restrictions that are different than what you and I may eat. But, we want to make sure that we were doing the best. We don't want to provide an unhealthy meal, because malnutrition costs this country $51 billion annually for seniors. Yeah. That was pre-pandemic. Social isolation, $6.7 billion annually. I wonder what those costs are today. We talked earlier about mental health issues.
Yeah.
A lot of people are saying that my programs that are just observing the seniors that were able to get to senior centers and get out before that were more mobile, said it's like people have aged 5 years,
right,
who no longer are mobile because they don't have the social stimulation, they don't have the physical activity. And so, it's just, it's a sobering topic that we're having here.
Paurvi, pick up that strain on mental health. We're going to have a mental health crisis in this country coming out of this pandemic. In so many respects, the after is going to be different from the before. That's probably necessary. We've learned things during these months that will change the way we live and work. But not just vulnerable communities, but communities that consider themselves before the pandemic not to be vulnerable have really been challenged on the mental health front. What do you do about that?
Yeah, well, that's listen, it's not a challenge coming out of the pandemic, it's a challenge now. Yeah. I think we can all, what Ellie, eloquently outlined is happening with our own families, right? It's happening within our own teams at work. It's happening, to your point about the magic ball. Like, you can't really assume telehealth is going to fix everything. You can't assume any virtual things will solve everything, because what's contributing to this isolationism is also the distance that being virtual is contributing to. It's a solution for some things. It's not a solution for all. And for me, at least, as I was listening to Ellie, it's really challenging a lot of our thinking. There's this kind of holy grail of test something and go to scale, and now we're there.
Yeah.
Everybody. I mean, I come from a business, Yasmina, talking about innovation and the power of that, right? We're all fueled by that. But there's a limit to what you can truly scale. And the personal connection that is required for each of our vitality is so essential. And we all have felt what this isolation really means. We've seen the joy of what some of it has brought us, which is reconnection in our immediate surroundings. But in terms of mental health and what do we do? I mean, I think we've got to really balance the expectation of some of these solutions. They may not provide the immediate turn that we're hoping for. And I will always come back to it is deeply personal. These are the things where the personal connection and the personal journey become incredibly important. What happened with our aging population, to your point, the first 6 months, that hit all of us. All of a sudden you saw your own parent in the story, whether they were or not, or your grandparent, right? And that added to a level of burden that we probably didn't realize was going on. And now we're coming out. And so what will we do is now go beyond panel after panel, but to start to ask for the kinds of change and architect that change. We are part of the vulnerable community. I think that is, you're hearing it with almost every answer that I provide. We are part of this vulnerable community. And so the responsibility that we're carrying now isn't just the roles that we play in our institutions. It's also what we can bring with our voice as we go through. So from a philanthropic lens, of course, we're doing that with the conversations that we can and learning circles with our partners, learning from them as well. And where philanthropy is at its best is in connecting the dots when we're seeing that there's some things that are happening or conversations that are necessary or ideas that are brewing, where we can bring folks together. And I think the example of Meal on Wheels and our partnership with them is a great one. At a time when it felt like the bottom was falling out, we're able to come in quickly and see what we can do together and ensure that things can be stabilized. I think there's a role for us in the mental health space here as well. But if we're going to do it, and I'll end on that, we can't do it without recognizing the system is broken. If we build as if it's the same as it was before, it won't work. And so this has been broken in mental health for a reason for quite some time. And so I think it is a reimagined system that we have to be incredibly honest about when we're coming into it.
Dennis, on the solution side of this, I mean, obviously, we've seen the numbers improve in many places around the country. I mean, obviously, we're all still trying to run from variants like Indiana Jones outrunning the boulder, right? I mean, we worry about the variants and what they're going to mean for what appears to be a period of irrational exuberance that we're coming out of this finally. The vaccines have made a big difference, but in some ways, the same disparities we've been talking about on health outcomes at the front end of the pandemic have exhibited themselves in vaccine access on the back end of the pandemic. What do we do about that? How do we combat this? I know this is a persistent topic of conversation. We haven't solved it entirely.
No, and Children's Health Fund, is a network of passionate healthcare providers and programs working in some of the most under-resourced communities around the country. And we do a lot of listening. And what this community of practice, what this body of knowledge is telling us is that, there is validity to the hesitancy. We need to acknowledge the reasons why people don't have faith in the science. And in acknowledging that, continue to work with some of the resources, in fact, that the Ad Council has put forward and localize them. Make sure that who we are putting forward as spokespersons are trusted community voices, are proximate leaders. And again, we're not waiting for them to come to us. We need to be making strategic, deliberate outreach to bring the vaccine services and information to them. Right now for children, of course, the approval is for 16 and up. There is an emergency authorization pending from Pfizer and the administration to approve adolescents, which would be, I believe, 12 to 16. We're not even looking at the 11 and unders yet, right? So if we're really going to reach a herd immunity, we're going to have to be working systematically and deliberately on working with parents, providing them resources, tools, and access, and allowing them to make the healthy decisions for their family and their children, which they will make if we approach them in the right way.
And Yasmina,
Go ahead.
I was going to say, Yasmina, that also assumes that people are getting access to good information about the vaccines when we know that just at the beginning of the pandemic, just as was the case at the beginning of the pandemic, where disinformation and misinformation was an additional element to be solved for, it's a problem on the vaccine front now, is it not?
Yeah, no, absolutely. I think, again, it kind of goes back to this question. And I think, Dennis, it's so smart to identify the validity of people's concerns. I was talking to a colleague yesterday about how in Ghana, there's essentially uniform resistance or hesitancy around the vaccine because they were testing vaccines for Ebola back when they were developing that, and they created a financial incentive. So there were people who volunteered because of the incentive, did deal with health repercussions, and it was determined to have been purely exploitive. So today they're like, no thanks, we're not interested in the vaccine, which, if you think about the long-term consequences of that, it's really devastating, and building trust takes time. You can destroy it instantaneously. So it kind of goes to something I was thinking about, Paurvi, when you were talking about, how do we make this real? And I think it's where the pandemic and the racial reckoning come together, that we have to start asking the question of who is leading the change, who is making the decisions. And we've seen a system where, again, decisions about resources, leadership of organizations, leadership of businesses are not representative of the communities that have been hit hardest by this. So I think everyone now is asking themselves those questions within their own networks, within their own, infrastructure. How do we create more of that representation so that over time we can actually start to see the trust built, saying, I think we are making these decisions in a way that serves our interest. We've looked closely at our portfolio, particularly in the US, where we've focused on issues related to poverty that are often linked with issues of race. And, we were kind of overwhelmingly excited to see that because of the kinds of businesses we want to support and their proximity to the people that they're serving, I think 60% of our portfolio are businesses led by people of color. But we wanted to really make that intentional and say, these are issues that we think, as you create role models, you create leaders within the system that can over time build, I think, a more equitable model. Those are the hard questions that we have to ask ourselves. And how do we allocate our resources and authority to those who, have more proximity to the issues that we're facing? Mental health, I think, is a fantastic example because, Paurvi, to your point, these are issues that people are facing universally. But we also have to sort of look and say, where is the greatest vulnerability? Where people maybe have less likelihood or access of taking advantage of mental health services, and almost begin where the job is hardest, rather than where the job is easiest. And that's a change. I think a lot of us have thought, let's go for the low-hanging fruit. It's just not good enough anymore.
We know the zip codes. We know where to start. We know what to do. And the imperative is on us to just do it. We can't.
Well, and I would say that the HIV pandemic actually, as someone who professionally grew up in that movement, the exact same arcs. I mean, if you take a step back and people who were a part of that, we have been here before. And everything that is happening today from a different lens has been happening in that pandemic as well. And so, Yasmina, to your point, in terms of who's making the decisions, how did that get architected? What did it require? Your Ghana example is perfect, right? The same things that were happening throughout the testing and treatment dynamic of what was going on during HIV. And I think there is something about that is important here as we think about it. We see all of those champions on the news helping us at these times, especially this time last year. But when you think about now, this issue of trust, which used to be a footnote, right? It was always the footnote in the research study about what was really happening here. It is now front and center. And while it feels qualitative, it might be incumbent on us to put some real meat to what that actually means, because our rate of change is inside of the rate of trust here. Yeah. And at the end of the day, it's back to what I think Yasmina and I have been talking through, which is how to make sure that we are comfortable letting go of power of the decision. It isn't just representation. I can be at the table, but if I can't be heard, and if I didn't influence change, it really hasn't accomplished much. So what does it take? And I think that's where the HIV pandemic and the activism that was inside of that shifted a bit of that from a different lens.
Could I just add one thing, Evan?
Ellie, please, and then we're going to do a last series of questions for all of you, but please go ahead. Yeah.
Okay, just real quick. It's interesting. We talked about vaccine hesitancy, and I think in contrast, I'm hypothesizing a little bit. I actually have a pulse survey out right now with my programs, but I'm hypothesizing that I think most of the vulnerable seniors that we serve, it's an accessibility issue. They would love to be vaccinated. I mean, Evan, I think you're in San Antonio. You're near there, I think.
Austin.
Okay, Austin, sorry. But, in Texas, I know 3 programs right off the top of my head that have facilitated mobile vaccinations, getting vaccinations into the homes of homebound seniors. And for those who are more mobile, getting them to a senior center to get inoculated. But it's so difficult to reach folks. And I think when we think about how do we facilitate not only herd immunity, but also helping older people who are so socially isolated and depressed, how do we help them resume some sense of normalcy? And I believe the pivot, the intervention for socialization for them is going to be being vaccinated. And like I said, I don't think it's as much hesitancy as it is access. We talked about rural, Evan, getting people in rural areas.
Hopefully, Ellie, over the next couple of weeks, we'll see the floodgates open in terms of vaccine availability. Here in Texas, we had a pretty significant urban area that shut down its mass vaccination clinic because the demand wasn't as great, because vaccines were much more available in other places other than these mass sites. We should all have that happen to us, right? It should be that good.
Right, but to your point, that kind of accessibility is for people who can get to a site.
Yes.
And I'm talking about people who either can't sign up online because they don't have broadband or internet, or their fingers don't work well, or it's really complicated and they need a helping hand, or they need transportation or someone to get there. That's the kind of accessibility I'm talking about.
Very, very, very much true. So here in the remaining 7 minutes, I want to go around the panel. And Ellie, we got you right now, so let's start with you. And then we'll go Ellie, we'll go Dennis, we'll go Paurvi, and then we'll end with Yasmina. 3 questions to answer. What was the most important thing that your organization was able to accomplish to address some of the disparities we're talking about in the last year. So first thing is, what was the most important thing your org was able to accomplish? The second thing is, what has been the biggest obstacle to doing the work that you believe you've needed to do? And then the third thing is, assuming that we are indeed here in the home stretch, how will you spend your time going forward to get us from the during to the after? Right?
Okay.
So most important thing, biggest obstacle, and how will you spend your time for the balance of the pandemic?
The most
Ellie
important,
first.
okay, the most important thing is the dedication of staff and volunteers to try to leave no senior behind, to scale, to be able to serve at least 1 million more seniors.
Yeah.
And millions more meals. So that's the first thing.
Most important thing. Okay, biggest obstacle.
Right. The biggest obstacle, funding. The resources are not there.
Yeah.
Prior to the pandemic, we had mounting waiting lists in almost every state. Those have only gotten worse. A Government Accountability Office study said that 8 out of 10 low-income, highly vulnerable seniors need Meals on Wheels, but aren't getting it.
Yeah.
The third, going forward, we talk about the importance of public-private partnership. My colleagues, my board, my programs believe that one of the best opportunities is two things. Not only to continue to build the momentum with partners that we weren't working with before, private philanthropy that have stepped up to help us if they now see the impact of what they've done with us. How do we take that to scale? But also partnering with healthcare, because I believe that good nutrition, socialization, and safety are paramount to health and wellness. And if we can partner with healthcare so that they can help provide more funding,
right,
so that because we can feed a senior Meals on Wheels for 1 year for the equivalent cost of that senior being in the hospital for 1 day or a nursing home for 10.
Excellent answers. I'm actually being told we have a little bit more time than I thought, so I'm going to let you all go a little longer if you want to go on this, and we'll come back around on the back end. Dennis, next, please. Most important thing Children's Health Fund was able to accomplish in the last year to address some of the disparities we're talking about. Biggest obstacle, and how are you spending your time here in what is hopefully the home stretch of the pandemic?
I reflected on this recently, the first question especially. And, I go back to March of 2020, and it was Friday, March 13th, when we officially closed the office and went on remote.
That was the end of the end of the before and the beginning of the during, right?
That's correct.
Yeah.
And what we found, and because we're a healthcare organization, and we were doing a lot of listening of our network partners. And as the pandemic really grew, we found that hospital rooms and emergency rooms and hospital beds were filling, primary care clinics were emptying, right?
Yeah.
They were losing revenue. They were facing literally furlough of healthcare staff because they didn't have the reimbursement revenue to keep staff on. What an atrocity.
Yeah.
We were able within the first month to secure a lead gift of $2 million from a corporate partner, from PepsiCo. And we literally, that money hit our account on Thursday. It was out the door Friday, and
Right.
No one was laid off. We were able to put resources and tools in the hands of those local programs that allowed them to meet the moment.
Oh, that's extraordinary.
It was
Yeah.
just incredible.
Yeah.
And we were able to continue that. The biggest challenge.
That was the most important thing. Most important.
I think it was, because it got us out of the gate, and
Yeah.
it let our partners know that we were here for them and that we weren't going to be doing it on our own. We weren't going to try to be directing how these funds were going to be spent.
Right.
Get the resources locally, make the decisions. Let us be your platform to talk about what's working.
All right, and then biggest obstacle over the last year.
The biggest obstacle, and I think, Paurvi, you've mentioned this a couple of times, is this isn't just general, it's generalized, it's personal. All of our staff have felt these same emotions. When George Floyd was murdered in May, I mean, this is not something that happened someplace else. Everyone internalized this action. And it isn't just that, it's been one thing after another for the past 14 months on top of a pandemic. I think the biggest challenge is continually reminding ourselves that we too are important. Care for the caregiver is important. And as an organization, we need to not just be focusing outward on making sure resources get to those proximate leaders, but making sure that our staff is also taken care of, listened to, and that those concerns are acknowledged.
Got it. Sort of institutional self-care, as it were, right?
Yeah.
Yeah. And then how will you spend your time in the home stretch now of this? What's the most important thing you're doing?
Trying to make sure that that light at the end of the tunnel is not a train. We need to make sure that this vaccination effort is in full force, and that we are looking at vaccinating every child, everyone, before this pandemic.
Do you have, in your mind, within the constituency you serve, is there sufficient access? I mean, again, you mentioned, there's the 16 and overs or 18 and overs, pardon me, who are now have availability here. And herd immunity is, of course, the goal, but the reality is, even outside of vaccinating younger people, there are still places in the country that have not put particularly good numbers on the board today. Here I am in a state that is bragging about having vaccinated just over 1 in 4 Texans. At this rate, herd immunity will be achieved in 2070. I mean, it feels like it's taking a very long time to get needles in arms. So
we are continually hearing we can do more with more, and that what we need to be focusing on is deliberate outreach into those under-resourced communities and not waiting for them to come to us.
Excellent. Paurvi, back to you with the 3 same questions. Most important thing that your foundation was able to accomplish to address some of these disparities over the last year, biggest obstacle, and the time you're spending in the home stretch, what is the most productive thing you're doing?
Yeah. Well, listen, those are such great questions. I'm glad we have a little extra time. I will say for the most important thing, we didn't let boundaries and barriers get in the way. I've never been more proud of a team that actually took March 14th from a very different place than March 13th last year, right? And just grabbed and moved. It was a time when you just didn't let bureaucracy and in our own internal systems and even the way we processed how to solve a problem shifted. So for me, that was one of the most important things, not just for my team, but our entire company. You could just see what happened. And we were offering the IP for our ventilators. I mean, there was a level of getting inside of this to solve it that I've yet to see. So that was incredibly important on the macro scale. But on the micro scale, I've been leading work like this for some time. I have never seen the power of relief through helping in the way that we've been able to unleash during this time. I'll say that again, back to what was March 14th. Like March 14th was me for 3 days in a row asking 60 people that I knew, what would you do right now that would make you feel better? What can we do? And from that scraped up all of the kinds of ideas of things that we needed to do that would help. The asking of what? It wasn't the ideas are awesome. It's not that. It was the action of asking, because what happened was people who felt helpless had an opportunity to contribute, even an idea. And that has turned into something that some of our own junior staff came up with an idea called a power hour, where now employees all around our company are hosting an hour with a nonprofit, talking about the issue, spending an hour doing something in contribution to the issue or with that nonprofit, building their team, but having the relief of doing something and being in conversation. Because what is happening right now with these systems is that everything has to be rebuilt differently, and we have to be honest. And that can't happen without honest conversation. So that is something I'm incredibly proud of.
Or a most important thing over the last year. What's your biggest obstacle?
The biggest obstacle is the fact that we're still mired and anchored inside of believing that more money will solve it. More money is part of it. But are we, there's a big concern that we've heard it. All of these dollars went out, but did anything change? We've heard it for the crises before us, even before we came to today. So that is a huge obstacle, is this assumption that just doing that more will solve it. And then it's butting up against an obstacle of the cadence of outcomes reporting that most companies are used to seeing.
Yeah.
So what changed this quarter? What changed this year? What changed in 3 months? I'm the one that's saying it to my team. But we've got to find the right balance, because at the end of the day, for philanthropy, you know, most of us now, and especially taking a page from the impact investors, is that it's about the change that's happened, not about the money that was given.
Got
And
it.
so if we really believe that, then how are we going to do that in a way that that is not just story after story, but in addition to story after story, tells the story through the real results that are changing, but in the right timeline.
Yeah.
We have to grab that now.
And so
And that's a huge
assume,
obstacle.
with regard to the timeline, if you assume that you've got another sort of plus or minus 6 months of this before we get back to something that resembles normal,
Yeah.
how will your time be spent most productively?
Yeah. So it's going to be on conversations like these. And working really hard not to help everyone realize that we will be done in 6 months. I'm sorry to say it.
Yeah.
And that I think is really important to settle into. That is also a personal journey. I know we all have to figure. There is no post-pandemic. We're here. And actually something about that is something to celebrate. Everything about the nimbleness that Yasmina was lifting up, all of the problems that we've been seeing and solving. So for me, the way I'm getting through this next phase, because it is the next phase, is to pull up all of the things that were working and making sure that we don't lose sight of it, because we can already see it starting to happen with return to work, right? That we need to do that, but we don't want to lose sight of the things that were really important that did help us succeed. Because again, March 14th was the beginning of something really important. It wasn't just the beginning of the gloom and doom. It was also the beginning of working together to solve something. And we don't want to lose that. So that's what I'm going to spend the next however many months, probably my career, making sure that we don't lose that.
All right, so bookmark that point about the afterwards. We're going to come back to. Let me go to Yasmina, ask the same questions. Most important thing that Acumen was able to accomplish to address these disparities in the last year, biggest obstacle, and then here in the home stretch, how are you spending your time?
Yeah, so I think the most important thing for us was that we really did show up. We were able to mobilize resources from our board, from our corporate partners, from foundations, and distribute $6.5 million to enterprises on the front line.
Yeah.
All of them still exist. 109 organizations. They've helped 2 million people deal with the worst effects of the pandemic. And you know what it showed us wasn't just we need to show up for them, but the ways that they show up for others. So that was sort of for us the most important thing, was not to sit, talk about it, figure out a strategy, reflect, think should we change, but just show up the way that they did, and learn from that and see, you know, what is working from the resilience point of view. What are the gaps that still exist? How do we continue to evolve our model so that we're actually giving entrepreneurs what they need in order to thrive? And that kind of brings us to the obstacle question. You know, we see a lot of risk aversion right now, and we see it across the board. We see it from government programs. We know governments are in some cases pulling back because their revenues have fallen so dramatically. And we think that this excitement about working with entrepreneurs and innovation is going to be heavily tamped down because of this risk aversion and this sort of contraction that we're seeing, and it's at the worst possible time. I get it. We're all scared. We've all been scared. If it feels risky to leave your house, it clearly feels risky to invest in new ways and invest on unproven models. But if there's anything we've seen, it's that we need the innovators right now, and we need local and representative organizations, entrepreneurs, and leaders to be really leading the way. And so it's recognizing that risk aversion that's there, and not sort of, you know, sticking with the rhetoric of like, yes, let's all do the right thing. But it's like, let's do the things that sometimes feel scary and acknowledge.
That may not, Yasmina, and may not work. Right?
And may not work. Exactly.
Nothing worth trying is going to guarantee 100% succeed. Right?
Exactly. And I think folks feel like we can't afford to fail, but we also can't afford to stick with the status quo. We've just seen that the systems we have are not fully up to snuff, so we need to be willing to innovate. In terms of where we want to go moving forward, you know, we want to double down on these local representative entrepreneurs. We are finding ways across of our work to go earlier stage, to take bigger risks, and to build capacity for these organizations that we learned didn't really have a lot of skills or resources around long-term financial planning, and they need that. We're actually launching an $80 million energy access relief fund with a group of 16 investors to make sure that the SDG 7 to improve energy access, which has huge health implications, doesn't take a huge setback as a result of the pandemic. So we want to keep those companies alive and moving forward. And another project I have, and this is sort of related to this role of the private sector, we want to convince large corporations that the time to build inclusive business models is now. And when they, and Paurvi talked about supply chains and procurement, when they make decisions to support these kinds of businesses that reach deep into vulnerable communities, whether they're communities of color, women, low-income communities, elderly, when they do that intentionally through their business, we start to see a different kind of economy and not the one we have now, which I think is continuously marginalizing people and frankly making a lot of money for elites. And just to say, this isn't the system we want. And so we're actually really excited to have more dialogue with the mainstream private sector about how we build a different system rather than show up in the crisis with goodwill.
Well, that is
we need something different.
It's such a great point, because you can't really tell whether the reaction to the moment we're in is performative or whether it's sincere, right? Mm-hmm. And the reality is best practices would always be, don't redo everything at a moment of great need and great crisis, but do it in advance of that so you're well positioned to deal with the crisis and that moment of need at that time.
Yeah, right? And to build it fundamentally into how we think of success. You know, that if companies said, we want to make sure that the people we touch through our business do have a safety net, are protected, are healthy, then I don't think we'd be seeing what we saw now. And so there for us is this really important conversation about what's the kind of economy we want to live in so that these vulnerabilities don't continue to deepen over time.
Yeah. As we wrap up here, I'm going to just ask one last question and I'll throw it open to the group. When will we recognize when this is over? I mean, I love Paurvi's point about the fact that it's never going to be over. I mean, it's both depressing, but it's also exhilarating in some ways to just acknowledge what we all probably know. And that is that it's going to kind of migrate down toward the horizon line, but never actually get there. There are always going to be lingering effects of this. And we have to be vigilant going forward and thinking about every aspect of this. But at some point, we're going to recognize our lives as resembling, quote, normal. Although certainly the after is going to be different from the before. So when is that? What will be the trigger? Any of you jump in. What would you say is the answer?
I don't know if there really is an answer, Evan. I think, Paurvi, I think there is no post-pandemic. It's now. Yeah. And we've got to embrace the now.
Maybe we're in the after now, Dennis, whether we know it or not, right?
Right. And we, in order to build back better, we've got to take those lessons that we've learned, all of the innovative ideas I've heard today on this panel, build on what works and create something new. Yeah. And it's up to all of us. It isn't up to the government. It's up to the collective, whether it's the public sector, private sector, civil society. But we have to make sure that those underrepresented populations, those community leaders are at the table this time.
Good. Anybody else on that?
Yeah, I think it's recognizing that that we are in a world in crisis, that inequality is present, it's grown, and it won't go away by itself. The rising tide will not lift all boats. This is a real question of leadership. And we have another crisis right on the horizon with climate change. And that's going to have a devastating impact on communities everywhere, but again, will be disproportionately impacting low-income people and marginalized people. So I think it's to say we live in a world in crisis, and how do we lead from that place and really center our definitions of success, our models of leadership around putting people and a sustainable environment at the center of decisions, as opposed to, if something goes wrong, don't worry, we'll do the right thing. But no, let's really lead differently, because this crisis is now, it's like you said, it's the now, and it's where we live.
Well, if we're going to talk about climate change, it's going to take another hour and 15 minutes. I think we probably should. I'm going to use that as a cue to land the plane safely here and to say that I think we've had a great conversation. We're so fortunate to have had the time we have from these great panelists, and I want to thank them for participating. Paurvi Bhatt, Ellie Hollander, Dennis Walto, and Yasmina Zaidman. Thank you so much for joining us. Thanks to our hosts for having us, and thanks especially to all of you for tuning in. Never before has it been more important at the end of a panel to say, stay safe. Stay safe, be vigilant, everybody, and we'll see you on the other side. Thanks.
Thanks, Evan. Thanks, everyone.
Bye, everyone.